Hi everyone, my name is Miss Sam, and you can find me in the Wantagh or East Yaphank office. I'm back for another Therapy Tip Tuesday to talk about fluency. So fluency refers to our smoothness, rate, and effort in our speech production. Everyone can be disfluent at times. We often find ourselves using filler words such as like or even repeating a word or phrase, but these are our typical disfluencies. So fluency disorder is an interruption in the flow of speaking. It's typically characterized by an atypical rate, rhythm, or disfluencies. There's two types of fluency disorders I'm going to be talking about today: stuttering and cluttering. So let's start with stuttering. Stuttering is our most common fluency disorder. It's an interruption in the flow of speaking, and it's usually characterized by specific types of disfluencies. And these include repetitions, prolongations, and blocks. So repetitions can be of the sound, syllable, or monosyllabic words. So for example, if you're saying, look at the baby, or let's go out, and repeating. Prolongations are usually on our consonants, and when it isn't, for emphasis. So it could sound something like, sometimes we stay home. And then our last one, blocks, are inaudible or silent fixations, or the inability to initiate the sound. So these disfluencies can affect our rate, rhythm of speech, and they also might be accompanied by some negative reactions to speaking, such as avoidance behaviors. It could be avoidance of sounds, words, people, or even situations that involve speaking. It can also be accompanied by escape behaviors, and these are our secondary mannerisms, such as eye blinking, head nodding, or other movements of our extremities, body, or face. We can also see physical tension as well. Our second fluency disorder is cluttering, and this is characterized by a rapid or irregular speech rate, some atypical pauses, maybe some pragmatic issues, and there's also that decreased awareness of the fluency problems or moments of disfluencies. So some techniques that we use in our fluency sessions are speech modification techniques. And these strategies are aimed to make changes in the timing and tension of speech production, or alter the timing and pauses between syllables and words. So two of the techniques that fall under this category are easy or gentle onsets. That's the gradual onset of voicing. We also use light articulatory contacts, and that's using easy articulatory posture. So some of the ways that we practice our techniques or target them during our sessions is by reading. So we'll usually pick one of the strategies that we like to use, whether that's light contacts, easy onset, or even slow speech, and practice that while we're reading, because that gives us a more structured way to practice our skills. Then we also practice during our spontaneous speech, because that's our everyday speaking. That's what is natural and normal. And we'll practice our techniques while we're just having normal conversation, or even playing a game such as Would You Rather. We also like to work on our diaphragmatic breathing. So if you think about your chest to your stomach as a pool, your chest is the shallow end and your stomach is the deep end. So you're going to get the most support from your stomach. If you're pulling all the breath from your chest, it's going to be shallow. You're not going to get the most support that you can get. So we like to put our hands on our stomach, feel our stomach rising and falling as we're breathing, because that's where you're going to get the most support. I like to do diaphragmatic breathing while following videos on YouTube, because it gives you a nice visual to follow. Or you can even do it while counting. 3 seconds in, 6 seconds out. But that is all I have for today on fluency. I hope everyone is having a great, better speech and hearing month. I'll see you next week for another Therapy Tip Tuesday. Thank you.